Okay. Yeah, so again, I would like to encourage you with the posterior and, oh, okay. And yeah, encourage you with the posterior. It's important that you do understand what this is. This is part of the course. In order, you have to, if to be a midwife, you have to understand what it means to be posterior, when it could possibly be a problem. And in fact, I'd like to throw that question to you. What is the possible complication, like threatening complications, something more than prolonged labor? Definitely the biggest thing you'll find with a posterior presentation, a longer labor. Is there anything else that is risky to mother or child based on this presentation? I'm not aware of
Uh,
any.
I remember just one which is rare, that the head is so extended that the mentum is stuck on the pubic bone. That's it.
Correct. That's what
Remember,
that
yeah.
one, correct, because they can't, that's the point. That you cannot have a posterior face. A posterior face presentation cannot keep coming because they can't extend any further. Yeah, to get around, they have to get over that what do you call it, pubic bone, and they can't. So they've already extended too far. So, but
But
yeah,
so, for example, in this labor is going on and on and on in labor, and the mother is complaining of back pain, and if we do a vaginal check and she's maybe just 3 or 4 centimeters, that's what typically happens. And then she
yeah.
says, I want to transfer. What kind of help can I get in a hospital? I don't know. Can a hospital help actually in posterior labor? Can
They
epidurals help?
can, but they don't. They can. There are things a hospital could do. In the old days, they would put in a spinal block, right? Or an epidural, so they don't feel the pain anymore. But nowadays, they're very, very gung ho. Straight away, they will go do all these interventions, which are the complication, right? So the first thing they're going to do is they're going to give her Pitocin, right? They're going to augment her. They're going to traumatize her by catheterizing her, which of course inflames the tissues, and we're already having an issue with space. So let's add a few, and when you're dealing with a few millimeter of a hose up there, we're only talking mil, man. You don't need more mil in there. Water is great. Hot water is fantastic. Hot compresses are wonderful. Hospitals do not provide this. We do know that well, only if you get the good hospital, if you know a good hospital and it sounds like perhaps more and more hospitals are hopefully starting to make a move to learning what morality is with your patients, which is actually your job is to look after them. You're supposed to serve them. Yeah. We're servants, don't, it's only this falsehood. I'm a midwife, I'm a doctor, I'm a surgeon. Now I'm God. Idiot. You just became a high paid servant. You're as Shudra as it gets. We're as Shudra as it gets. Blood, mucus, pus. How many of you swallowed it? We're as Sudra as we get. Untouchable, yes. So again, I'm what is the actual fear of a posterior? What dangers does the baby or mother come into? Again, we identified prolonged labor, which can lead to fetal distress. You can get actual disproportion as a result, right? Again, poor presentation. This is just, again, your common disproportion, which can happen with any presentation. Anything else? Anybody else? Can anyone name another complication that is serious for mother or child in a posterior labor and delivery? Funny
Will
how
it
we're
be
making it. Yeah, really.
yeah, so I was wondering, will it be a stuck labor? Like, so the baby is out, but there is shoulder dystocia or something?
No,
No?
posterior doesn't lend itself to that at all.
No?
No, because it's still for shoulder dystocia. Either way, once the head's out, the shoulders will rotate, right? They'll restitute, and they're restituting to the oblique. So they try to get out on the cross angle. So, and a baby being posterior, it's more, the complications come with the flexion bit where they have to engage and they flex, they either flex or extend, and in different orders accordingly to get born. That's different. That's the issue with the posterior. Shoulder dystocia is different from that. Yeah, so unrelated. So the point I'm making, it appears to me there's a lot of noise about no problem whatsoever. You come across disproportion, you can potentially come across disproportion at any time in any presentation. And at any presentation as well, you always give a woman a trial of labor to see what happens, because you actually don't know. We might have a damn good idea of what might happen, but I'd still give it a go. And you never know your luck. You could be wrong again.
Yeah. Yeah. Sometimes when we attend births longer, I am realizing that sometimes we start thinking about ourselves more, how to get out of that situation. In the beginning, we are more of in the mode of surrender, that sit at her feet, sit at the feet of the laboring mother and let her guide us. But then over the years, we assume this position that I can guide her. I can, you know, tell her things she can do to ease this labor. But maybe that is also an intervention because I'm interfering with her intuition now.
Again, I don't have so much faith in a mother's intuition. I just
I do.
don't. I mean, we all have intuition, and even with my best intentions, man, I've screwed it up. So with my own kids, and they're my kids in my own labors, I'm thinking, I don't know everything, and I don't believe everybody does, and I don't believe every woman's in touch with herself. I can
Yeah,
easily lie to myself. I'm always lying to myself, aren't you? Anybody here doesn't lie to themselves? You're lying. You're lying.
now, see, the first gut feeling that comes, that's always true, but we kind of muffle it with our logic and rationale and all that. That's what I will call lying. But the spurt, that spark which comes, this gut feeling that this is happening or not happening, that comes only once. Once you muffle it and logic, you use your logic, it's gone. So it's kind of tricky.
Oh, it's definitely tricky. It's definitely tricky. But that's the game. I guess that's just the game you play here. And again, we're never going to get any closer to nailing it. So you say about the Reposo and things like this, is this interfering? No, I don't think so. You're offering your mother is telling you something. So you step up to assist her. Indeed, babies get into funky positions. You know, I don't give astronomical credit to anyone. I don't think pregnant women necessarily know everything. I don't think all babies know what the hell's going on. I think we're all just as confused as everybody else. I think
Yeah,
we're
like
all
mothers, they would say what to do. I
oh,
don't know what's
I
happening.
know
I don't
the
know.
baby's going, what am I supposed to do? The mother's going, what am I supposed to do? The midwife's
Yeah.
going, shit, man, what am I supposed to do? Honestly, none of us know what we're doing. And the more I practice, the more I'm convinced of this. The older I get, the more I talk to people. You saw Rhoda Kuhn posted that thing from Bill Cosby's show. I don't know if you ever saw that show, the Bill Cosby show, but he was an obstetrician. He was a doctor. And it was just so that whole conversation of where babies come from. Anyway, and he takes the baby out. And actually the girl's right. No, you don't. But oh, anyway, it's just a journey. Don't know what else to say, but have fun. But again, who's responsible? Why do they want the home birth? So again, I guess you're going to have to get that pretty clear. Why are you trying to do this at home? And honor that. Make sure it's super clear to them. They decided to have the birth at home. Make sure you have a nice, clean, and clear conversation with them. And somebody said something. I was asking questions. He gave me an answer. And based on his answer, I made a decision. I said, okay, that made up my mind. And then when he heard my decision, he said, I wish I'd given you a different answer. I wish I'd answered you differently. Don't answer me, don't talk to me or give me a sentence to manipulate a response out of me. So don't talk to your mothers to solicit a specific response. Get them to speak honestly. Who's responsible? Who's making the decision to have your baby at home? You? Are you? Are you? It's your, who's responsible? Who's taking responsibility for this? Whose decision is this? Get them to repeat it. And in India, I need to start becoming more professional and accountable legally. And these MOUs are part of the process. And it's part, we do have this MOU, we do have the patient's rights and responsibilities. Rights and responsibilities. Yeah. So, yeah, read them the Riot Act. Make sure that they're very clear. They made the decision and it's their responsibility to make the proper calls. And we're just their hand holding. We're informants too. So as a midwife, as a midwife doula's job, especially the doula, is to educate and inform. And again, do not educate do not offer information to solicit a choice out of the parents. Give them honest information, even if you're not sure if it's honest. There's research papers out there now. Whatever gets published, you can put it out there. Be honest. I'm honest. I put out shit for vaccinations and against vaccinations. I don't say what side of the table I'm on. Here's the argument. And I even use my kids as examples. My kids and my sister have gone against me, and I use them as credible examples of an opposite choice because it's their choice, not mine. So, yeah. And I think it's very important in India to get that point bang, bang, bang hammered into the heads of parents. It's your responsibility. It's your responsibility to make your child healthy. It's your responsibility to educate your child. It's your responsibility to feed him. It's your responsibility to know how to bandage a cut on the finger, not whip him off to the hospital. You know, just get a Band-Aid and some turmeric, people. Yeah.
Yeah. So, Sneha, would you like to move on to the case we wanted to discuss? Okay, I think so. I'll start. So, this
Yeah.
is the mother who has had two C-sections and very, very unsupportive family, very, very unsupportive. Um, Even her own mother, she had so many issues with her own mother because mother had kind of muffled her complaint of sexual abuse at the hand of a relative, and mother was like, just shut up because he's a close relative and you can't talk these things like that. But she suffered in silence a lot. So there was a lot of history of suppression of emotions, I will say. Then she married to a man who was relatively good to her, caring, but again does what he wants. So all her pregnancy, the man was telling her, "You're getting a C-section because this is our third baby. You've got two C-sections. You know, I'm not supporting anything other than that." So she keeps doing her research and comes across Sneha. Then she takes her husband to meet Sneha. They talk. They have a long meeting where Sneha explains what it is to try for a VBAC after two C-sections and how we handle it at home, how it goes in the hospital. She kind of gave objective information. Then this woman calls her up and says, my husband is not ready, so we are not doing a home birth definitely. And by the end of the pregnancy, every day her husband is kind of pressurizing her. When are you getting your C-section scheduled? When are you getting it scheduled? She's like, no, I want to wait for labor. I want to wait for labor. And finally, Sneha gets them in contact with our doctor, our kind of doctor, Dr. Arohi, which has supported different kinds of births for us. And this was VBAC after two C-sections for first time for Dr. Arohi also. She has done all the VBAC after one C-section. So she was also very supportive and she said, okay, let's see. I mean, if you come in labor and if the baby is coming out, we'll just let it happen. That's it. Like, I won't do any interventions, but you have to make sure uh, you are laboring maximum time at home and you are healthy and you are doing all that work. I will support. I will just give you the institutional support that you need, but I won't intervene. And that was more than enough for us. And by the time labor starts, they're always on the fence. They're going to the hospital, they're not going to the hospital. Finally the woman says, I'm not going anywhere, my pains have started. And then she start 1-2 days they go by just like that. She's having few contractions early morning, then 12 o'clock, by noon her contractions are fading away, and then she's again back to normal life. And she's asking, what could we do, and this is happening for like a week. So
And twice she got this anxiety attack because the husband had already booked her for a cesarean. So 2 weeks, just prior to the dates he has fixed for an appointment for a cesarean, she was getting this anxiety attack and a lot of vomiting happening, all of this. But suddenly, there was this date of 18th of Jan, and everything stopped. Everything was calm because she was really starting to get few contractions here and there. So the husband was, he kind of came into the phase that okay, she's starting labor, let's wait and watch. So things were good at the end of her labor beginning journey, but her anxiety attacks were too much to handle. Like for me, it was very difficult to see a mother vomiting her everything out, like, literally after her vomit, she used to be eyes up, all pale and very, very dehydrated. So this was the labor where she was getting contraction like every 5 minutes, where I went and saw her. So these were the patterns of anxiety attacks as well. Whenever she knew that she was going to have a cesarean next day, she used to vomit. But also in the labor, she was just vomiting. Tapasya continued.
No, it's better you continue because you were there at the labor and her labor was very peculiar because I was thinking this vomiting is a sign of her cervix opening, but she has always had, and vomit means a lot of fear and anxiety. Uh, Lots of times, if you have had this pattern before, and we were thinking that probably she's more than 5 centimeters, because contractions are pretty strong. They're lasting from starting to peak, they are lasting almost 40, 50 seconds. So that's good. She has had contractions all night. So in the morning, let's go, she'll be dilated. We go with that expectation, and there she is at barely 2.5, 3 centimeters and vomiting violently and all pale and um, pretty and she's complaining again of bladder, of this feeling of something there in the bladder or something. So yeah, Sneha, you can better describe the situation.
So then I went in the morning 5:45, and she was sitting with only a t-shirt with the on the back. She was lying on the back throughout. She had no shoes with,
कोई
was
चारों
it?
मालूम है, आता नहीं समझ.
She
She
was
was,
lying on her back.
yeah,
Now, कौन फोन है?
she was lying on the back. Give me a minute.
Yeah. Well, I have a question. When you get back on, if you can describe what the anxiety attack looks like. Yeah.
She, see, she always feared a C-section, and whenever she thought of a C-section, she would get all panicky and got nauseous, and
So what does that
that
look
was
like?
her
So would
body's
she
reaction.
hyperventilate?
No, she was very, very quiet. She would be like, close her eyes, and then she would go, try to let it go, but you can see from her face that she's keeping everything inside. Even in labor, she's not shouting or she's not. We are asking her to, loosen her jaw, do horse lips. She's not able to do it for a long time because
Right. We did do that.
opening your jaw is kind of letting go of the anxiety, which was very difficult for her. So all she would do is just close her eyes and breathe.
So she mentioned to me that, so she was lying on the bed. I was like, okay, but the pains were coming and she was vomiting. Her plan. So suddenly now, because the contractions were there, her husband decided, let's have a home birth. So we were like, okay. Um, and Arobi is also like, she was fine. She said, get what the mother wants to do. It's okay. I am there in case you need me. So then when I went home, the husband was kind of taking care of the children. So they had a very small apartment, 1 BHK, the Mumbai style. So she was in her bedroom. She was on her back and just saying that, there's a lot of pressure. And when I went, the first thing which I saw was that picture I made, the bulge on the vulva. So it was very bulgy. I never saw that.
On the
Now,
vulva?
yeah, like the
No,
pubic
on the
area.
pubis.
On the pubis.
Pubis, yeah, the upper part.
Yeah,
Yeah, yeah.
pubis.
It was very evident that it's different than what I've already seen. So I mentioned that to the person. The person said, okay, because she is bulk, she's heavy on weight, so that would be her extra fat. Now the first thing,
Yes,
because of our
yes.
experiences, we understood that the bladder should not be full. She should be going to the to urinate, and she was doing that well. So she said, yeah, I'm urinating. So we kind of thought that it's just the extra fat. And because she's also lying down and, so I don't know. Then later, it was only we both were there. We kind of slept. So I prayed my prayer and then she said, let's sleep. So I'm like, okay. So I was sleeping. She slept for 145 minutes. We slept good. Both of us, absolute silence and, everything. And the husband was also relaxed because I was there. So he was taking care of the kids and the kids were on the phone and he slept. Now she was going to the washroom. Like in every half an hour, she was getting this vomiting, severe vomiting, So she was not able to eat or drink anything. Now, when she went to the toilet, she saw the husband sleeping outside, and then she started getting very, very irritated and frustrated. She said, this man, what should I say? I was all pain in night, and he was just sleeping and scrolling the phone and lying down and not being there as a support. He doesn't care for me, etc. What should I do? I don't have a father. I don't have a brother. No male figure in my life who can be protective towards me. But this man is really protective because he does not even let his children play outside even for a minute, without supervision. So the definition is different. She did not feel cared, and he has definitely screwed her up in her last few weeks of pregnancy. There's no doubt about it. And the mother, the figure she is, she hates her. The daughter hates her for whatever action she has done in past. But now because she's the mother, so they are living. So they lived in a native place in Ratnagiri. They only came for birth in Mumbai. They live in a native place. So they were kind of managing. Now this, while she started crying a little. She said, I have never failed anyone. I did never disappointed anyone. I did what others want to do. Why am I getting this? So she felt that something is not good. Later, after some time, she said, I'm getting this bladder pinching. This is discomfort, Sneha. This is not pain. This is discomfort. I was like, okay. Then we did kind of rebozo. We used not Nux Vomica. We used Epicac for vomiting. She felt better after Epicac, homeopathy, and she was able to eat a date or so. And then later, again, she said, there's pinching. So we kind of thought because she's getting this pain like after for every 5 minutes, and the pinching pain would be the cervical lip. No, it was not Ignatia. It was Epicac.
No, you can also, in this particular case, you could consider Ignatia. Because there's a lot of grief. There's a lot of sadness coming from her. She's feeling a victim.
I don't know. Now don't talk to me.
And a victim.
कोई भी टी शर्ट देख लो पहनने के लिए भी जो भी है खेलने के लिए दुकान आई एम नॉट तो फिर दूसरा कुछ भी पहन लो शर्ट पैंट पहन के जाओ so then she was saying so we thought of cervical lip okay and now Tapasya said Sneha do a PV to understand better so that and I was kind of not feeling comfortable because I never saw a woman like this in this condition. Though she was tolerating well, she was not asking me to give pressure and asking me to do something, just be there. But I was feeling unsafe. I was feeling that I would need someone in the space. So by 11:30, 12, I did a PV, and just with these two fingers, I could feel a rim. A very tight rim, like this, around my two fingers. So it was only that. Only this much, and there was this tightness around. So.
Oh, bummer.
So
bummer.
I was like, I did not wanted to say, but I was only feeling it's only 2 centimeter or something like that. But I was not correlating it with the pain she was getting. How can it be 2 centimeter when she is, so much in pain? And then I told to Tapasya that, this. So again, we thought it would be cervical lip, which is coming down. And then I told my friend, the other friend, Ramiza, who is also a nurse midwife, but not practicing at all. I asked her to come in because, I felt that, I need someone else in the space.
Can I ask you, how high was the baby? So you can It,
No,
I
it was
understand
so.
that
So this was
there's a
I was feeling.
stretch.
Yeah, this was the
Yeah.
stretch. It was the rim, and the baby was here, head to the
So
left side.
baby's still what? -1, -2?
Yeah. So the baby was not here or at the cervix. It was far.
Okay.
The internal part was little softer, but I did not have the guts to spread it and do something. But this was the stiffness which I found, and but I did not mention it to her. I just spoke to Tapasya, and later after an hour, she was just getting this feeling to push. And I was seeing her perineum to be very, stretchy. There was whiteness at the perineum, and she was shouting and kind of stretching her legs and kind of she's grunting. So I was like, okay, we don't know. Now she got tired again, so I asked her to go to the toilet, take some warm bath. She felt better. We did rebozo with we did rebozo with Palsatila, or I don't know what was that tapasya, but we did rebozo, uh, inversions and rebozo. She felt better with rebozo when I was holding her. I don't when I was doing an abdominal lift, and after that, again she did not complain about bladder. Once she said, I don't know what's happening. So I said, are you concerned about the baby? She said, no, baby is fine. I said, okay. So what is the other thing? I think I am not fine. So we kind of asked her to release, but she was, she's objectively she just cried a few tears, and still she was back to her normal life. And then later she said, Sneha, when she came from the toilet, she's saying my bladder is leaking. I was like, okay. I thought now this was my experience that if the bladder is you're urinating, it's fine. If you are not having problem in urinating, it's fine. So now then afterwards when she's like, I feel like my bladder is gonna burst, and she did not had pain at the back for a long time. She was just having that down there at the lower abdominal area. Oh, and then my friend came around 4:30, the nurse midwife, and she checked, and she confirmed that she's 3 centimeter dilated, Sneha. And but then Tapasya asked her, is the head applied to the cervix? So she said that it is applied now. So when I had checked in the afternoon, it was not.
Mhm.
But
Okay.
now the head was applied on the cervix, and she said it is
Nice.
3 centimeter.
Okay.
And the water bag was intact, but she was getting this little bloody discharge, which was again normal. All of the things were normal. Like, it was not something which was out of our hands situation.
Yeah.
But the bladder was just giving her a lot of discomfort. Bladder leak or bladder pinching, or, so we thought cervical lip, that it was not cervical lip. And then when she said 3 centimeter, now obviously I was exhausted in that space. So Tapasya said, recommended that you go home, because I just stayed 2 minutes apart from the place. So she said, go home and then come back in the evening. Let's see what happens next. The mother was okay. The mother said, okay, you go and rest. I'll coordinate. As soon as I left, I don't know why, I felt that I'm not coming back to this place. Then I came back home. I took a bath, and then I was resting. Then later I just thought to just call and see what's happening. She said, I'll also be with my children. I was avoiding them since long. Let them sleep with me. So I'll do my thing. You also go rest with, etc. She is not picking up my call at all. I called her twice, dropped a message, nothing happening. Now I was short confirmed that, she is going to a hospital. Now later, because she only stayed near to me, my husband said, let's go home and see if she's there, so that you get an idea that you are supposed to sleep or not to sleep in the night. So we went, and I went up to the floor, and I saw there's a lock. So they had already gone. That this was at 9:30 p.m. in the night. So then later in the morning, she messages me that I am blessed with a baby girl with a cesarean, and the baby passed meconium. My bladder was rupturing, and my uterus was rupturing. So I got a stitch on my bladder. The baby passed meconium. I don't know what information she had, but obviously they took her to the NICU. The baby is still in the NICU. It's been a week now, and yesterday she messaged me that they are taking her for 2D echo. I don't know what's the situation. Again, the same tactic, like not talking, not picking up the call to understand. So just a small message every time. So I do my part of messaging her twice in a, like no, not twice in a day, 2 times. After just in 2 days, one message about what's up, how's the baby doing. So she keeps me that way updated. Otherwise, she's not taking up my call. And she is home because my cook is working with her. She is cooking for her as well. So she says
Oh,
that they are very weird family, Abba. They are very weird. They keep fighting. And how can a cesarean mother eat a fried rice or a outside food? Like, leave it. So now the baby is not with her, but she is coming and going and just uh, fluctuating between those things. But the baby is soon going to come to her. So the bladder rupture and uterine rupture was something which she was going through.
well, I'm not convinced, as I said before, because they've said this stuff to me before, and it's lies. They openly lie. So unless I can see evidence of a rupture either in the bladder or in the uterus, I've heard them lie so much, it's incredible. Especially the bladder. So everything that you're telling me, so she's complaining, you're seeing this bulge build up, even in your drawing. When you have retained urine and the bladder starting to enlarge like this, you will get that bulge, but it's clearly coming. There's something hanging on top of the pubic bone, whereas the drawing that you kind of gave, which sounded pretty much the same, similar, which was fatty over the top of the pubic bone. So that swelling is on over covering the pubic bone rather than starting above it. Yeah. So retained urine, distended bladder will be a bulge that's clearly above the pubic bone. She kept passing urine.
Yeah.
She kept going to the toilet. There was a point where she starts leaking urine. She gets a stinging sensation. And she's only 3 centimeters and the baby is very high. None of this makes sense. None of this makes sense. So I don't trust what the doctor's telling you. What does make sense to me, not now. What does make sense to me is that she had a lot of issues, which are understandable. She's been sexually abused. She's been negated. She's been made into the problem. So this is the classic scenario of sexual abuse, especially in India. There's a lot more heaviness to sexual abuse within a family. There's a lot more stigmatism. And this can be devastating. Yeah? No, you're muted. You're muted.
Also, what I feel is there was a lot of infantilizing of her by the husband also. It's like
Well,
she doesn't
this is
know.
what kind I
Even
mean. Yeah.
he was supporting, not even supporting. He didn't even come in the room. But he tolerated her laboring at home to an extent. I think, he said, let her do whatever she wants to for a while and then I'll take her, get a cesarean. That was the attitude.
So the mother did message me that as soon as you left, Sneha, my husband and my mother, they said we are not waiting anymore. and in 10 minutes I was taken I was taken to the hospital. So I said, if you would have made me, a part of it, or if you have mentioned it to me, I would have spoken to Dr. Arohi personally, and then you would have gone to the better doctor who can give us clear picture, and not someone who is already against you and gonna make some story for you. So
Yeah,
he
exactly.
was not picking up the call. So if I said, even if we even if we appreciate home births, and we are pro natural births, we cannot deny the fact that the mother is not comfortable. We are for the mother. So I try to tell her that if you felt that you want to go to the hospital, you just would have gone to the hospital. So, but then, it was destined that, they would be very near. So the hospital is near to the house, which is easy for their commute. But there is, a value which they need to pay. Like, the baby's out, they cannot take the baby, and, there's no breastfeeding happening, and so many other things. But so what I see is now the mother is texting me saying that, this is my mistake, this is because of me. That's how she has been blamed. Just after the birth, both the mother and the husband, they're saying the same story. Because of you, my daughter is in the NICU. Because of you, my daughter passed meconium. Because of you, etc., etc., etc. So now the mother is like, and they anticipated that this would be a baby boy, because a radiologist friend just said that it's a baby boy, and it was a baby girl. So now she's getting into that guilt factor that, oh, it's a baby girl. So Sneha, tell me, if there's an adoption center, can I adopt a baby boy? I said, just shut up. You already have to take care of two children who are so young, and again, they cannot live with their mother, without their mother. Even at the cesarean, they were there, not in the room at the OT, but they were there in the space. She couldn't rest without them. They were there in the space. So I don't know. So she kind of want to be like pleasing everyone, trying to do her best and falana dikan, but
No,
that's not.
it just seems pretty classical to me. This is an imprisoned woman. From the get-go, she has been silent. She has been negated. She has been invalidated. She has been told she's not really worth it. Now, a husband can be loving, but as you were saying, Tapasya, infantizing her. I wonder, and of course, this is part of Indian culture and society where women are not appreciated. Women, so here you are, Sneha, there, advising another woman, and they're all looking like down at the women as being stupid, and we're just going to wait for them to finish their little game part, their little toy party, and then we'll go and the adults will take over. Uh, so with a person like that, with a story like that, with a family like that, it's a recipe for disaster is what I'm learning. Yeah, but that's how I feel about the outcome of the birth. She was living with saboteurs. She was living in a situation where she herself felt like a prisoner. She felt like she had no rights, and in the end, she had no rights. And for some women to be dragged in for a cesarean section is another version of assault. And for a woman who's been sexually assaulted and told to shut up and probably blamed for the assault, this is just more and more trauma. It's never happened to me, but I can't imagine being forced to be put down on a table, strapped down, and somebody actually run a knife through my gut and steal my baby from me. I think that would be extremely traumatizing, and you would only be treated like a fool. So yeah, I don't see anything good coming out of that situation. And all you can do is just feel sorry for these women. And she's got a daughter now. You got to teach your women how to stand up and fight. I don't know how.
Yeah, and that again has an angle because it's a daughter again, so the mother-in-law is not happy, obviously, and this woman is asking something about adoption,
Yeah, already.
adopting one more baby or giving away. I don't know, something weird. But I think that was more of an emotional stuff.
Yeah,
In
but
the end, she's gonna
it
take care
still
of.
tells you a story of what the household is like, right?
Yeah, yeah.
I mean, that's heavy, and that's the heavy societal pressure on women.
So Annie Fry mentioned in her book that there are different types of rupture: traumatic, silent, and some things which you will be able to recognize. Sometimes you would not be. So what do you think? If she mentioned that yes, Neha, it's a stitch on my bladder. I am pretty sure about the bladder rupture. I asked her, did the bladder or uterine? She mentioned both were kind of rupturing. She said, I have
Well,
a bladder.
the urethra. I mean, the urethra could also have a tear. So what actually tore, if anything? Hey, Riddy, what do you think?
Bladder. It's not the urethra, bladder.
And have you seen so understanding this picture that Sneha and Tapasya are telling us, have you seen such a thing? Can you bring any light further to this pain that she's experiencing?
I would like to
Uh,
interrupt. Sorry, Riddhi, 1 second.
yes.
Mhm.
Um,
Yeah.
could there be adhesions, scar adhesions to the bladder, because bladder is pretty close to the uterus, and previous two
Of
C-section.
course. Of
Yeah.
course.
So yeah, please go on, Riddhi.
And also here, Tapasya, I remember that this mother, she had visited the doctor who is kind of a natural birth friendly. When she said to me that when she saw my stitch, she said, yours VBAC is not possible. Though it was a classical, low transverse kind of stitch, but she said the doctor mentioned that yours is not possible. And now I was kind of, getting back that thought that, even if the doctor would have seen the way she's been operated or, whatever, I don't know if you can analyze outwardly, but if the doctor had understood that this cannot be some proper way of, I don't know if this can rupture or what. Can that be diagnosed before?
Sorry, just keep going.
Looking at the way her cesarean stitches were, what do you think, Tapasya?
I'm listening. I'm back.
Now I would like Riddhi to take on. I really don't
I
know.
want to know what that's interesting though about the incision. And why
Hmm.
didn't I think of that before? Yeah, Rita, you have something to add to that? And do you know what it was? What did the scar actually look
Yeah,
like
I
that?
can.
Yeah.
Yeah.
Really.
What's
Well, we're wondering,
yes? What you
okay,
saying about the scar?
I'm wondering about so the rupture of the bladder, or so we're not sure, but the doctors they're saying there is a
Mhm.
stitch in the bladder. Although like the mother's urinating. She continually urinates. But there is a point that she's leaking and she thinks it's urine. But of course, we didn't rule out, and it was on the tip of my tongue, amniotic fluid, but still yet. What do you think, Rudy?
It could be scar disease. It could be a stitch on the bladder, meaning the previous C-section, because I've seen that. Um, and but I'm just wondering, it might not leak. I mean, Gladys don't.
I cannot hear
I
you.
mean, if she's
See,
leaking after the stitching.
You're a little muffled sounding.
I'm muffled.
Oh, and she's gone. I could hear that she was saying that she'd seen that before, depending on the stitching of the previous C-section, depends where they put their sutures. So I'm interested to know what Sneha saw or what the doctor saw in the scar, right? So if I understood you correctly, a doctor saw her scar and commented that she couldn't possibly give birth again because of where he saw the scar. Is that correct? No?
I don't know why, KL, but somehow me and Tapasya, we couldn't get to this mother for her previous history. She came like a wave. She just said one fine day she comes and she said, I cannot do it. And we were like, okay. I said, I'll take another birth because if you're not there. So she said, yes, please continue. I am not there for this birth. Okay. Now then, after 2 weeks, she comes back and she takes a consultation with Tapasya. And then she says, I'm doing it. And this is the first moment where I have not written anything about her. I don't know why. There is no mention about her previous histories. I just saw those two children and I've just palpated her 3 times or 4 times. So in the last few weeks, the husband was, very eager to know the heartbeats. So she used to, because I used to live near, she used to just come over and, get herself checked. So it is something which, later on, this mother, she hasn't paid. There is no formal things which I've written. There is no contract gone. But I did everything, kind of to support her prenatally.
So did you learn anything?
Oh yeah, a lot of other things. I did a
Well,
good
sometimes
labyrinth
that's
with
what
her.
it is.
I,
That's
I
what
did
it
a
is
good labyrinth
sometimes.
with her for 3 hours, and in that labyrinth, she kind of, came up with her sexual abuse, etc. So that gave me an idea. So when I just saw that 2 centimeter dilation with the tightness of the rim, I was sure that this is something which is stopping her, her mental space and
Correct.
her past history. So I and Tapasya were telling her that release, just cry, just let go. She cried few tears, and then she was like, okay. So she's the only daughter of for the mother, and still the mother doesn't love her. So she
What to
has her own
do?
problems.
What the hell? How do you fix that? How do you fix such a thing?
I would
Savannah,
like to say something. Just give me 2 minutes. Yes, just two
sure.
minutes. I'm coming.
Okay. Look forward to it. But I mean, sexual abuse as a child is very debilitating. It's very damaging. And the abuse that women in India, and it's not just India, there's other countries that do this. It's not just India, but we are in India. We are talking about India. So I'm not going to talk about Saudi Arabia, you know, but the treatment of women in India is horrendous. That how can I just can't understand how must it be not to have that love and acceptance from your mother just because you were like your mother? How it makes no sense. And from that point onward, nothing will make sense to you ever, will it? From the moment you're born, will that make sense?
I
Nothing in
told
your
her
life.
in her labor that can you forgive your mother right now? While she was looking at her, and she nodded no.
Yeah. Hey, I think I would be hard pressed. It would be hard because what you'd really want to do is go up to your mother and fucking rip her eyeballs out, right? That's what you want to do. And guess what? You're turning into a mother. Does it get any more confusing? it's so mistaken. It's so despicable. It's so back to front and clearly obscene and disgusting that any logical person would go crazy in a female's body. This woman has been subjected to at least sexual abuse, but again, surgical abuse, that's pretty serious too. A lot of women put the two together.
Vidya is not able to join. Are you the admin or
Really?
like kind
Yeah.
of?
I know Rudy can't join. I'm just hoping Savarna will come back. But yeah, it's still, this is a topic I would love to, it's normally one I avoid, but it seems, but this whole of women, because a woman's supposed to give birth under her own steam, right? She's supposed to be encouraged and held up and supported. And the way you support somebody is by giving them love and kindness and encouragement. You can't support anybody by discouraging them. That doesn't make sense. So this system, and you're tackling a system that doesn't make sense. That you're going to try to tell a woman she can birth naturally, but you're going to abuse her. Yeah.
Okay. I'm here. Can you hear me? Yeah.
Yeah.
So I guess when I was listening to it, and I think we have discussed the case of Brinda recently also, right? I mean, Brinda did not go to all these kind of things, but uh, something similar traumatizing, right?
Mm-hmm.
Having that contact and having that uh, those sessions where you just let them talk about their history and whatever kind of trauma it is, whatever, even in this with this woman which we have now, Tapasya and me. So when we were having sessions, what we did was just ask, I just asked her, like, first you explain them what is the pain and suffering, the difference between them, and how do you relate suffering, how do you relate your past traumas to the pain in the birth. And once they talk about it, once they take it out of that pain, it really helps them to cope up through it. I mean, this woman was telling all these things in labor, right? Because she was connecting that suffering with this pain, correct? And that
Very good.
happens naturally. That happens naturally. Whenever you are having some physical pain, then you start thinking of all your past traumas and you kind of start thinking, why me and why this is happening to me? And all these are emotional thoughts. It's not the real physical sensation which is giving you this kind of thoughts. So I guess to come out of that, initially when you are having the sessions with women, especially when it is a sexual abuse, especially when it is a trauma they are gone through, so just keep on digging that what trauma you had before, how you dealt with it, what you were thinking about it, about like when you were dealing with it, or have you dealt with it, or you have just kept it in your mind, you haven't dealt with it, you haven't healed from them, and you just keep on going, right? That also happens most of the time. So connecting with that and trying to heal that trauma before the labor, I think that should help, or that should work. That's what also said in, or that's what they also tell or train you to do in Birthing from Within, that through the birth art, through the labyrinth, through all those pain coping techniques. Before using all those, just go through the trauma which she had in her life previously. And it's more the tendency how you deal with it. They're going to deal with the trauma in your pain. Like you're going to see that pain as also another trauma, another major trauma in your life. If it is like if you are traumatized already, then there are chances, more chances that you relate that pain with the trauma, and
That-
which you are
that's
not supposed to do actually, right? I mean, it's just the sensation.
that's fascinating. Actually, I would like to so Agashri, she's done this labyrinth, and I'd like to again, I've said before, I don't like digging into, generally speaking, usually I do not like touching women's sexual assault issues. It can open up a Pandora's box of traumas. But we do experience that in India, there's heavy trauma for women. That I like what you just said about how we associate our pain with these traumas, these emotional traumas. And indeed, it's often brought back, it's all the same area, genitalia, and it's a seat of emotion for women. The knife, this woman, she's got an issue with a knife. She's already got 2 cesareans. A knife is often compared to the penis. So this also becomes a threat. And she was showing an indication of having traumas during her pregnancy, where she came and left and came and went. So as I say, normally I'd leave that stuff alone, but I think this may be a time in the age, that the time to start bringing these techniques out, to speak to the women, to get deeper into understanding what could possibly be bothering her. And maybe another time we can get Savarna to show us the labyrinth, if she doesn't mind, and how that works, if you guys are interested.
And it's not only sexual abuse
Correct.
related trauma care. It's not only
Correct.
trauma
Yeah.
related to sexual abuse, right? People have gone through many kind of traumas and they don't talk about it, and they have just it is just sitting in their heart, right? And mostly the women, right? And they
Yeah.
just maybe not prefer to talk about it. I mean, I was talking with this lady and she was telling me about the death of her friend in COVID. And that was a
Right.
trauma for her, and that she could not accept that. It wasn't just the sexual trauma that or
Indeed.
abuse that they go through. There are so many things which they can relate as a
Yeah.
trauma, or they take it as a trauma and they haven't accepted. And if they haven't accepted that, I guess it is difficult for them to accept that pain or that sense.
Yeah. Yeah. Riddy's back. So did you want to try to say what you were saying before about the incisions? Hopefully we can hear you. Yeah.
I will, Gail, I'll just take a minute to join back.
Sure.
Can
Okay.
can you hear me now?
Yeah. You sound clear this time.
I lost the thread. What were we talking about?
Okay. It was the lady in labor, and the family was against home births. Yeah, it was her second VBAC, right? She's attempting for a home birth after 2 previous C-sections. She had a lot of complaints of what sounded like urine retention. However, she kept going to the toilet. She kept passing urine. And then afterwards, she never got past 3 centimeters. The head was poorly applied. When Sneha went home, the family immediately transferred her, and she had a cesarean section. And the doctor said that the bladder had started to rupture along with the uterus. And Sneha said something else, that another doctor had taken a look at her previous scar and said that with a surgery like this, she could not give birth naturally. Is that right? Did I get that right, Sneha? Yeah, okay. So I was interested in that, especially, if she's packed, I don't know if she's still there, but especially if she's passing urine,
Yeah.
why would the
Hello.
blood?
Yeah.
Yeah.
Can you hear me now?
Yes.
Yeah. So I yes, I don't know what's going on.
Yeah.
Okay. Let me switch my. Okay, go ahead. What were you saying?
I'm just wondering, so would a bladder rupture if it's leaking? Like urine is being released. Why would yeah.
Yeah.
But you
So
mentioned possibly adhesions from previous section.
right. So there can be so the scar was not nice. That's what Sneha is saying, that the previous two scars were not but were they what they were horizontal the way we do now? I mean, at the pubic symphysis, were they like that or were they vertical? They were horizontal. They were horizontal.
Mm.
Okay. So with bladder, what I can think of is scar adhesions. I've seen adhesions. I have seen adhesions in second C-section, previous adhesions to the scar, and uh, did you stitch the bladder back? Because I have also seen that removing the adhesion and stitching the bladder.
She mentioned that they stitched the bladder and
Hmm.
like she just got discharged 2 days back, and she said the catheter was there throughout, and there was blood in the urine. When
Right, right. Yeah.
Interesting.
So this is bladder. They stitched the bladder, and the bladder, yeah, urinates, and now she might have issues for few months in retention, urine retention, and she might also experience pain if the bladder is full. These are the two signs post this. And uh, so she had her third C-section, correct?
yeah,
Right, right.
So, but
Mhm.
how would the bladder rupture if she's passing urine?
I don't think so. The bladder ruptured when she was passing urine. No, I don't think
This
so.
this is
Was
my
she given
point.
oxytocin? Was she given oxytocin
no,
in the hospital?
I don't know what happened
Uh,
in the hospital, but she said that. So I left her space at 5:30. She said after 10-15 minutes they decided to go to the hospital. By 7 o'clock the cesarean was done. So I don't think so. They did all this oxytocin and stuff.
yeah, so it's a previous scar issue. It's a previous adhesion issue. And I don't think so bladder got ruptured. Either it got uh, injured or there is an adhesion issue. Yeah,
Exactly right. And what
yeah.
do you think?
But
So
then,
what do you
like she said, she said leaking, and she also mentioned in the label that it is. I think that it will burst. So how is this two things correlating?
Le so you are saying leaking,
In
and when she was trying,
contractions, she was
haha,
feeling that the bladder would burst, but she was
bladder
also
would burst.
urinating. Yeah, she felt that the bladder is feeling as if it would burst, and I was
it
kind of
makes
Like
making
it's so
sense.
full of water. Okay. Then it could be
Well,
adhesion, KL.
yeah, exactly. It makes sense that it
Yeah,
would be,
yeah.
the whole picture now sounds very clear of adhesions that's stuck to the bladder. So whenever she's contracting, and remember what's happening with contractions, you're, this is all fiber, muscle tissue that's migrating upward. It's all pulling upward. So if they've created scar adhesions to the bladder, as the uterus wall is pulling up, it's going to drag on this too. And I can imagine that she would get this, have a sensation of having a full bladder because it's being pulled on, right? You
Yes.
know, I can imagine that feeling. And with the, in particular, during a contraction. Yeah, that makes sense to me, but it is not so. Again, this is this is actually an indication of the, whoever the previous surgeon was did a shitty
I
job.
was. I actually wanted to say that not just natural birthing, but C-sections need to be done very carefully. And if
Yes.
Yeah.
you do a shitty job, this is what happens. And I feel not just shitty job physically, I mean, even emotionally, in mentally, like the cesarean I was in KL, they were doing it in anger.
Oh.
Like, if you do it in anger, if you do it with, and they were like four people working on her. I mean, it has to be just one or two. I mean, in government hospital where I work, we were very strict that people will, and one would be the surgeon who's doing it, one would be the assistant surgeon, or like me, who would assist, holding the instruments, and we will not touch anything else. But 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 in this the last previous cesarean I did last year, it was they were four people, and the surgeon who was doing it, she pulled out the baby and then she was done. She did nothing else. The other three were stitching the uterus back and stitching the other layers. And i- uh, it so this but the cesarean was done neatly but in anger. But poor cesareans, if that happens, then all these complications happen, and it is not, and it could be dangerous. I mean, we're talking about danger here.
Yes.
And believe me, even if they have started doing C-sections like on a tenfold rate of what is needed, they have not yet
Learn the skill.
mastered the art of C-section, mastered the skill. And that's why when a mother wants to go for a C-section, I'm very particular where she goes to, because there are one or two doctors here who have been really appreciated by the in the postpartum period by the mothers. And I have surveyed who does a good C-section in your community. I mean, in Chandigarh, I've uh, surveyed that a little bit, and I know only two, three doctors whose hands is really amazing in C-section. I mean, they really do a neat job. They've never had any complications post C-section. So, Sneha, maybe we can. So I also feel that we need to also add, if you want to go for
I
a
was thinking
C-section,
this. It
where do
goes
you
back to the
go?
morality.
Yes, where do you
And
go?
look at
And
this lady's fortune, that
right,
she had someone like Arohi. We did everything.
yeah,
We managed to, but she went back to that same crap where she had already had her
right,
cesarean.
Again, it's so
right,
interesting.
How?
Why do you keep doing this?
Yeah,
Why?
I
right.
was like, you repeating the same damn old thing. And
But
So,
she's
she's
so I've learned,
helpless. She's
I don't think
helpless.
she had much say in it. I think it was just the husband's decision. She didn't had any say
that
on
would be,
it.
but having me around and
No,
having
Bhagyashree, who is
you were not
Bhagyashree?
around, right?
yes,
They
but
were
she
just
would have
when
called me.
you went,
One
that's it.
call
He
to
was just
me.
waiting for it, right? No, they
Can
were
I
just
can I
Yeah,
say
waiting for you
something?
to go from
Can I say
there.
something,
They
guys?
yeah.
were not happy
Can
about
I say
you there.
something?
They were just waiting.
Yeah, yeah. Can I say something? Sneha and Bhagyashree and Divya? No, KL. Yeah, sorry, I was reading names. Sorry.
It's all right.
So yeah. So I think I'm meeting Bhagyashree for the first time, correct?
Me too.
Possibly.
No,
Actually,
I
no.
think we have said it. It's just a different name. Don't worry about it. Don't worry about
Okay.
She's Sonali. She's
I
Sonali.
think we
Sonali.
have
Sonali. Sonali.
talked with you. Yeah, she's Sonali. Yes.
Can you like show
Okay.
your faces so that we know who they are?
Yeah. Okay, I
Here
want
I
to say
am.
one thing, guys.
Yeah. Yeah.
KL, I want to say one thing very strongly.
Yeah.
Can you see me also?
Yeah.
Yeah, I can say one thing very strongly, and that is we need to fix a mother's being. We need to we need to we need to make uplift her soul, make
Mm,
her confident in her being, give her the powers of birthing. When we sit in the family and ask her to choose, and ask the family for letting her choose, and we need to fix the mother actually first, and then I have realized we need to do we need to fix the mother first and then talk about birthing, because they come with the broken soul, they come traumatized, they come with no voice, and then this happens, Neha. So what I feel our task should be, KL, and I'm very strong in it now. This is what I also did with Veronica, who is now going to Divya. I told her, I did a session with her where we were only talking about how do you feel and what do you need to choose. No matter what, you choose Chandigarh or Delhi, and we will work on the other parameters. So I feel, KL, that's why women are choosing the same trauma back again, because they are okay. They don't know what is not trauma. Okay, Tapasya has written something.
he always told her that.
I don't think so. He's not that intelligent. He would not do
But
that. The
no, but
mother,
he, yeah,
I
but he always kept saying, मुझे बच्चा चाहिए healthy, तुम्हारा कुछ भी हो, I don't care. So I don't know. I
Wow.
mean,
yeah,
But if
I
she
am
was,
not
So
feeling the same for
if
the uterine rupture. I'm not feeling the same for the uterine rupture. I think that's something which is not there. But I do feel about the
hmm,
bladder because I've seen her struggling with that pain of the bladder. So that is something which,
no, that's
yeah, so
again,
Scar
that's a
Adiji were
lie.
probably rupturing. Yeah.
there's a
But
uterine rupture
without,
also
she
in this
said
they
case.
said,
both of them ruptured.
so they
Both of them
said,
rupture.
that's what they said.
Yeah, they
I
said.
don't
That's
The
what they
doctor
believe
said
said.
it.
to her.
I
Yeah,
don't
yeah.
believe it.
Hmm.
I
If I
mean, if
don't
there was a
believe them
uterine
about the
rupture,
bladder, I don't believe them about the uterus.
Hmm.
If you lie, you lie. It's a lie.
yeah.
So, but I
And
take on, yeah, what you say about women, that you need,
yeah,
that,
yeah, KL.
yeah.
And I think we need to also fix doctors. I mean, we need to go fix their traumas because
Well,
they
we
are
need
just
to
This same
empower
asking.
doctor
them. I don't know
mentioned
if you can
if
Well,
you
fix
come
it
with the
Kale,
how.
if
baby's
you
head down,
remember,
this doctor
So,
mentioned if you come with the baby's head down, I'll put the baby inside and do your cesarean.
Wow.
This
yeah,
Why
was a
did
this
you
doctor.
go
kind of
back?
shit happens. Yeah.
So
Well,
because the husband called the Dr. Arohi twice and she did not pick up. Now because they have her
Okay,
official number and official numbers are
right,
kind of busy. So that's what I was saying. If
right.
they would have called me and I would have called her personally, so things would have been different. I would have been supporting her.
Different.
So,
okay.
but
So one
then
thing a couple of things I want to say. You mentioned, look, why did she choose you or why are you being chosen? Because you are.
Right.
This woman needs the support. There's no doubt that this woman's in a tough spot. And many of the women that are coming to us now are. This is what you're going to continue to see. So, and that woman, regardless of how, where entangled she is in her head, she still deserves loving support. So she came to you.
yeah,
You provide that for her where no one else will. Not her husband, not her mother, not the doctors. There's only one person, two people who were willing to look after her, you and Tapasya. Nobody else gives a damn. So that's what your job was. And regardless, you looked after her. You helped her out when she needed it. Maybe now she's not talking clearly to you, but that's another thing. That's her. It's not you.
Yeah.
She's going through trauma again. She got knifed again. This woman got knifed again. And that she got knifed, stabbed twice before, that left her with scars that continued to cause her pain. And then she got stabbed again. So someone was there to hold her hand, to wipe her tears and let her vomit, right?
Yeah.
Someone did that. That was you. And that's why you were there. Sucks to be you.
So for me, like, what I think is,
Do you remember, Kale, we had this concept even at the end when I just left from Mahapur, that we should have parent classes, like family classes for the birthing couple,
The whole
not
family,
just for
yeah.
them, but the whole family who is going to be involved there.
So
Well,
KL,
we
I
could,
met Priyanka. KL, I met Priyanka in Kerala, Kochi, and she was facing these issues. So she started a grandparents class where she
yeah,
would. So she said we started with this, that okay, let's involve grandparents, but then we started talking to the grandparents and taking them in confidence, and that helped. That started helping their mothers.
yeah, yeah,
The when Priyanka came to Nutan auntie's home last year,
yeah,
I went to meet her in December. So this is what she shared. And what I feel, one grandparent class, but I truly feel there needs to be a trauma shedding, whatever class. I mean, I don't know what we would name it, but a unstuck me trauma, where we need to work on their traumas before they go into birthing. Otherwise, they'll land up where they landed up now.
Before,
Before, yes, Sonali, before.
I
And we
think
don't need
all
to
of
wait.
us should read this.
All of us
I think
should
all of
read.
us should read this Birthing from Within. She has written Birthing from Within. She has written a lot about the trauma and how to deal with it and how to, get out of
And
that, how to make
b-
that lady get out of that before the labor. All the
birthing,
techniques.
birthing from birthing from within. And also, KL, there is this called working on your conflicts and then removing. Like, okay, I want to share this. I'm still not in birthing, but last year when I joined this class, I was traumatized. I was
mhm,
traumatized that I wasted my 12 years in in this obstetrics gynecology field. I was feeling I've wasted my time. I could have done any other business like selling furniture or doing interiors. I mean, I or I would have loved doing that. But KL, you asked me to join. You said just join, and remember we spoke about that. I feel traumatized and I feel drained, and you said even at least if you want to leave this doing this, at least leave it with a uh, with your heart filled with love and not traumas. I remember, I mean, I don't remember your words, but I remember the conversation. I mean, how I felt about the conversation, and I started doing these sessions only to heal myself so that I don't leave this world with traumas because that's all I had. Of course, I had some beautiful stories, but I mean, my heart was full of traumas. And I feel this is so important. Like 9 months, just talk about trauma, also talk about traumas and birthing from within. We can do EFT techniques. We can do, I don't know what we like. Everybody can curate their own, but Sneha, we need to bang on work on this. I mean, you want them to do more prayers. I don't know, but this is more important than doing their natural birth because I don't care if they even land up in a C-section. but they need to land up in a C-section without a trauma, and they need to choose the right person to
Without
do
the
their.
trauma related.
What did you say?
Yeah,
Without the
I just said
related
that
trauma.
without the related
With,
trauma, even if it is
yes,
C-section, there should not be trauma to the
yes,
birth.
yes. And I strongly feel husbands need to resonate with the mothers. I strongly feel, but if they don't, mothers need to choose. I mean, this is her body, her rights, her choice. I mean, there is no other way. We need to communicate that with the mother. And I really doubt if this is not the case, then why are we producing together? I mean, why are we reproducing together? Is my question. Because if the mother doesn't have choice with her
Absolutely
body,
correct.
this will continue with her kids. And then, I mean, why are we doing this? I am, I asked in fact, I asked my mother also that you were not quarrel with my father, then why three kids? I mean, you continuously fight, guys, and you're never on the same page. You don't resonate at all. You have no connection. You have no synchronicity. Then why did you go for three kids? And, she's like, oh, that's how it's done. And I'm like, no, it's not done like that. So at least this generation, now we can be better than our parents. I mean, we can be more aware, we can be more conscious, we can be more connected to ourselves and around. We can have better affinity, better relationships, better communication. I mean, everything is missing. And if we are just focusing on natural childbirth, I'm not in. I mean, if we have nothing else and we do a natural childbirth, that's not a win-win. The win-win situation would be we are working on everything else on ourselves also. We try for natural birthing, doesn't happen, no problem. We have a very good physician for a cesarean. We do breastfeeding, we connect with our baby, we communicate with our baby, we take informed decisions on vaccination. We are very generous in feeding the child, and we are spending a lot of time with the child until 7 years. If that is not done, just a natural birth is not an agenda for me anymore. I mean, I feel it has to be a complete package, complete picture. What do you say, KL? I'm very frustrated, by the way, right now.
I completely agree with all of it. I've also know we can't necessarily control it or win, if you know what I mean. It is very interesting how, for me, the women in India, yeah, it is a whole family affair. And sometimes I felt, I mean, we've been talking about this for years, that the issue with the in-laws and how they can complicate things in the family. And really some of my sense of it, especially in Mayapur, we were kind of coming to the conclusion of feeling we need to take the women out of the houses. It was actually easy. It's easier to remove the woman than trying to educate everybody else, which against their cultural beliefs, right? So for some of these women, they are taught, I don't care about you. I want a healthy baby. From some of these women, their mothers are telling them, I never wanted you. I don't like you. This is from the moment of conception. This is what the rest of the family actually believes. And chances are, if this is how she's been raised, the marriage is, chances are, is not one made out of love, but out of arrangement. She's still been handed as a captive prisoner from one box, from one cell to another prison cell. But as a human being, nobody appreciates this. No woman wants this. If she wants to give birth naturally, she has to be given the space and protection to do so. And sadly, sometimes what's required is to remove her completely from the family. Get the family, there's no educate. I've been doing this in the last few years. I've been doing this, Shanali, that I've been taking the parents and the grandparents. They're coming, and sometimes, man, I was really sure we had a winning combination, that the mother-in-law or the mother were quite alternate and really into natural methods. But when push came to shove, they were just as abusive and manipulative as ever, and were just as happy to whip these women off for a cesarean as anyone. So even though I've been running the classes for husbands and the rest of the family, fear is a heavy presence, and one that family members are more likely to hold near and dear is their fear, not their regard for you, right? If they've raised you like this, if this is how they've treated you all your life, they're not going to suddenly have regard for your intelligence, right? So I'm happy to give it a go, but I think we need to prepare, and I would like to prepare for separating them from their family if required. Yeah, Sneha.
So I just wanted to understand two things. So in labor like this, not like this, I hope I never see a vomiting mother in labor. But is the bulge a red flag?
Not necessarily. So that particular bulge is odd. Again, you're not
That's what I was
describing.
mentioning, that there should be a curve, isn't it, Tapasya? Like if there's a retention, there would be curve, a dip, and there's a curve.
Correct. Yes.
And this did not had the same.
Your drawing does not show that. The drawing you gave us does not show the dip.
Yeah.
It just goes like that.
Hmm.
So could be swelling, could be fat.
What are we discussing here?
The look of
Mother who
the
had a cesarean. So when I went to in labor, it was a bulge. I could see bulge on her pubic area. But she was leaking, urinating.
Sneha, I will say, Sneha, have you seen her before, like when you were doing the fetal heart tones, etc., and that bulge was not there?
No, I saw it for the first time. No.
No, but you have seen that area before, how it looked.
Yeah. I've seen
It was
her.
not just the fat.
Yeah, I have palpated her. I've also seen her that way. Once I also did a PV, no? Remember, Tapasya? When she was 3 to 4 days before her labor began. So I never saw that.
Okay.
This could be swelling also sometimes, right?
it could be,
If
yeah.
the mother is not mentioning discomfort, if there is no pinch feeling, nothing happening, so this is normal, right? But if she's
Yeah.
specifically mentioning, then we need to see
Well,
what's
I'd be
going on.
looking at it, and it does, like I say, there's a few things that you've said, such as another doctor having looked at the scar
At the
and
scar.
came up with this, said this is going to be a problem. I'm interested what they saw that indicated this. The adhesions sound like the likely problem, and the swelling isn't, the swelling as you describe it is not classical for bladder retention.
Yeah.
So, and she was passing urine, so it is pretty,
And passing urine, whenever I asked her to go, whenever she felt like going, and then later she felt leaking. And one time she said that, I think this bladder is going to burst. So that is a statement which I cannot undermine when she says that the bladder was ruptured.
100%. You did the right thing. Don't worry, you did well. Look, it's frustrating. It's frustrating. We're looking for we want a result out of this birth too. We actually want, not one of us, well, at least for me, I go to a birth and I'm attached. I want it to come out a particular way.
Yeah.
And, and it's always the same way. The baby comes out, the mother's happy, and the baby's happy, and the father's crying. That's all I want to see.
But
And
I was not attached that way, but yeah, this is something there, red flag. So my question is, can this be a red flag for the other time if I go? and see something like this. And also, the question for you, Riddhi, that it was when the gynac mentioned that, looking at her scar, I don't know, I was not present, but she mentioned that she said that with your scar, VBAC 2C is not possible. Though she is someone who does VBAC. Okay. But she looking at the scar. So my question is, can you understand from the scar, from the outer layer, like I don't know how. Can you understand if this can be
No,
uh, viable or no?
no. We have to do an ultrasound. We'd have to do an ultrasound and see whether what's the thickness of the scar. We cannot just look at the scar and,
So her
oh,
scar thickness at the last
yes, we
scan,
do palpate on the scar.
hmm,
Scar thickness is,
scar thickness was 6.8 mm just a week
I
before staying.
scar
This stuff.
6.8 FM is it's 1.5. I have seen 1.5 birthing Dr. Sushma's Noria nursing home, and it was not the it doesn't it because scar is the place where we do a horizontal cut. It's not the place which expands and contracts. It doesn't participate in labor. The
Okay,
rest of the fundus participate. Correct,
correct.
KL. The fundus
Right.
is the one that is participating,
Yeah, that's the bad one.
right?
Yes.
That's why we are cutting the horizontal. We are doing the cut at the lowermost. So it's like a balloon. So if it's a balloon, then the tail of the balloon. That's where the scar is done. And by
Mm,
checking, we do palpate the scar. Let's say the mother is there, so we touch. So like let's say if this is the scar, so I will touch like this and ask her, does she feel anything, any pain, any any kind of um connection with it, like effort pain. Let's say I'm touching here, but she feels a pain here, or she feels a pain here, or feels a pain, or she feels her bladder is being touched. Then we can think about other things. But just by looking at the scar with such a beautiful scar thickness, this is just a comment. This is just a random comment. Uh, just making just making her feel good about just so to make her feel good about that. Okay, even if the cesarean happens, that's nothing wrong. So these are the ways doctors prepare a mother for a C-section mentally, by passing comments like this. I truly feel, KL, I don't know about natural birthing skills, but I can definitely talk to cesarean mothers because I've seen so much of trauma and I can really connect
Well,
with them.
well, that's the deal. Yeah, there's a lot of trauma, and we're just seeing more and more and more traumatized women, which isn't going to help, right? You
Right.
know?
So when the
So
uterine rupture happens, does
Yeah.
it happen from the fundus or it happens at the lower
at
area?
the scar, a rupture
At the,
will happen at the scar, but also the scar itself does not tear because it's the thicker, harder part next to it. But the other thing to know physiologically what happens before rupturing, your your skin is thinning, 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 thinning until it tears, just like our cloth,
thinning.
right? It gets so thin that it just shreds. So
Okay.
when our uteruses and our body gets that thin, the tissues seal themselves off. The capillaries, blood capillaries, get out of the way. What? The
Mm,
blood capillaries move out of the way. So whereas we have this image in our head that if should the uterus rupture, there's going to be an explosion of blood. No, because first it thins, 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 and then tears, and the capillaries have pulled away. So it's not that big a dramatic scene, and is very rare anyway. Yeah, that's what I can say about that. I've
So,
never actually For me,
When
with
they
a
said uterine, when they said uterus rupture as well as bladder rupture, so you don't think uterus rupture would be the case?
it's very, very, very rare to have a uterus rupture. And the other thing about a ruptured uterus is women don't actually feel it. Because again, the nerve endings start thinning off and pulling away. So they actually feel relief and there's no pain. Leading up to it, there's pain.
Okay.
And what was the other thing? But it's also, oh, you were asking about the bladder. So that's super rare. Again, this is a botched cesarean. And I will say that cesareans are becoming so commonplace that they're not being, and again, there's this hatred toward women. They don't mind butchering you and stitching them up badly. And I think this is where you're going to get a lot more complaints due to surgeons, not due to VBACs. Does that make sense? You can still very safely and commonly have a VBAC without any issue. It's actually safer to have a VBAC than to go back in for a repeat surgery. Yeah, Riti, you had a question.
Before that, I just wanted to ask, what about the baby? Why the baby is in NICU for so many days? But while we were taking heart tones all the time, almost all the time, baby was sounding great. She was also saying baby's moving
First birth
great.
where I have, been very particular with the fetal heart rate. Seriously. And the baby was sounding well. And the mother's intuitively feeling that the baby is fine. That is also something which I would not negate. But then the doctor said that the baby passed meconium. Now I asked her only this question: did the baby cry after the birth? She said yes. So if the baby cried, and obviously they did cut the cord, and every time they see their baby, they take it to the NICU, and there would be meconium. I don't deny about it because she was not living a very healthy and very happy life. So that's okay. But the meconium went into the nose and mouth. This is what the doctor told her, and she was telling it to me. So I don't know if the meconium actually went into the lungs, or why was in the baby in the NICU for so long until today. And now they are kind of so the baby was on oxygen saturation, but now they're asking for 2D echo and other stuff. But throughout the pregnancy, she was never concerned about her baby. She was well confident about her baby.
Yeah, I was thinking of something. I forgot it already. The baby. What about the baby? Why is the baby in NICU? Because they always put the baby in NICU. Number one, when those babies come out, they are tortured. We've seen it. This is torturous. As I say, this is the actual waterboarding. Look up waterboarding. It's illegal, but you can do it to a newborn baby. And they do. And this will traumatize a baby. And they end up in NICU. So to me, it just sounds par for the course, which means, this is how they do it. Why is the baby in NICU? Because this is how they do it. Riti, you had
What
a
happened to
question?
the baby?
No.
Yeah, I just was trying to understand the baby situation and then my network got
Yeah.
So baby
flaky.
NICU. So she
Why?
told me baby passed meconium. Okay.
Hmm.
And but I asked her, did the baby cry? If it was meconium aspiration, then did the baby cry? She said yes. When the baby came out, the baby cried. But they took
Hmm.
her to the NICU. They kept her on the oxygen saturation. And yesterday she had messaged me that the baby needs to undergo a 2D echo. So I have no idea. The parents were not questioning the authority about what's happening. It's only the mother who is questioning and knowing, wanting to know what's happening.
Hmm.
But when things were fine, so does this bladder and the uterine adhesion or rupturing happening impacts the baby?
I don't think so. And
Bag was intact, okay?
uh,
Bag was not broken or like, nothing of that sort.
bag was intact. You were
Yeah,
saying amniotic fluid was intact. Uh, and what was the color and consistency of the meconium? I
I was
no
not there.
idea. Okay. So, 2D echo. Is there any issues with the heartbeat, like any arrhythmia or any different pattern? We can inquire that. We can respiratory rate. Actually, KL, in situations like this, we should go take a consultation from another pediatrician, from another hospital.
Yeah, sometimes the
And
pediatricians take a lot of time. As I mentioned, one of the child baby who was born naturally, but after vitamin K, they saw the bilirubin going 15. So because the pediatrician will come in the evening, the baby was under the light for 24 hours until the next visit. So you cannot
oh,
keep the baby for the pediatrician to then do the
come
checkup,
in,
come in, and
correct.
then comment, and then he'll be getting discharged. That was pathetic for me. Like, I was like,
Hmm.
hospital births, I would never recommend vitamin K. No, I wasn't recommending though, but that was parents' choice. But no, this choice is just suffocating for the baby.
Hmm.
So now this baby definitely would have got vitamin K shot, vaccinations, because in the
Exactly.
end, all things
Yeah, yeah,
happen.
yeah.
Not dinner. We
Yes,
Well,
cannot
yes.
pinpoint one thing.
also the baby will be feeling the mother's trauma. So
Yeah.
this
Hmm.
mother's getting, she was terrified, reacted very defensively and protectively about anything happening to her. Everything she was
Hmm.
worried about happened to her. The baby is on this journey and so close to this mother. Baby feels the mother's feelings and is affected. This mother
Hmm.
sounds like she was very much an affected, and yeah, she's feeling the effects of the abuse.
Hmm.
She
Hmm.
gets traumatized during this painful, difficult, questionable labor, where again, she has no support. Not only that, she's giving birth to a girl.
Yeah.
So this girl, she knows this is her future. She knows it. So I see her traumatized.
So
Yeah.
yeah, yeah. And the first two siblings are girls too.
One girl, other boy. First is the girl, and the
Um,
second is the boy. And now this is another girl. So throughout her pregnancy, she mentioned, the husband only cares about the baby. He just want the baby should be safe. Baby should be safe. Baby should be safe. And even if I die, all these sort of dialogues I was listening from the couple. That was okay. The husband used to laugh out for that. Yeah. So baby girl being in this kind of situation, and she did say that when we were doing labyrinth, that in her it took a lot of time for her to love her body in a way, like after marriage, being okay with her husband being intimate, because that feeling of abuse was always there until she gave birth to her first child. She said even
hmm.
during the birth of the first child, though it was a cesarean, the abuse was very, very relevant for me. Second birth,
Hmm.
after second birth, I have kind of, moved on and it doesn't impact me. But I don't know with this birth, what happened, what was
So,
her.
Sneha, is she related to you? Like, how did you land up in a situation
I
like
don't
this?
know. Someone gave me someone told her
Hmm.
that Sneha lives near you. She can be a support.
So,
A friend
I
in
think,
needed a feedback. So she got
okay,
motivated and then she came into our circle, and then
correct,
she
correct.
was confident that she
Uh,
would do it. She's pain tolerance levels are very high, Sneha. And actually she was managing
yeah.
it well. But when the bladder made a thing, she was like, I need to just sort my bladder. I'll take care of the pain. Oh, how could I sort bladder?
Do you know what Louise
Uh,
Hayes says about the bladder?
mm-hmm.
Pissed off.
Pissed off. Does she say
Yeah,
this?
that's what yeah.
Wow.
So heal
Yeah.
thyself. She wrote the book, Heal
Yeah,
Thyself.
yeah. I have the book. I have the book.
Yeah. So
Yeah.
that's what it says. Urinary tract, kidney stuff, being pissed off. So this is,
Hmm.
I mean, the whole picture, everything you kind of say paints
Connects
this
to each
perfect
other.
picture of this an abuse victim for a long time who wears that. That's her identity, which can understand. Yeah, I can understand. I'd hate to be in that situation. Powerless, bloody powerless.
Hopeless, powerless.
Yeah. Geez, imagine, and nobody cares. Nobody cares. I just want a healthy baby. I don't care if you die. I don't care if you
That
suffer.
is, this is
Yeah,
such a
that's what
big
the,
statement.
yeah.
This is such a big statement, and I would have, I don't know. I mean, it's giving me some
That is
heat
what
wave
she
inside.
felt that the husband feels, but the husband obviously did not feel that way. I understand that, but she kind of has this feeling that he doesn't care because see, half of the men they don't know how
Imagine,
to.
imagine feeling,
Yeah,
imagine
feeling is
feeling it,
yeah, that
imagine
is
feeling it for your own husband. Imagine feeling. I mean, it is so scary,
yeah.
and uh, she needs counseling for something, so that she doesn't reproduce again. She doesn't fall into that cycle of planning a child again. So I
No, no,
think
I guess she's not
I,
that.
let's,
Have done.
I think let's think of, yeah, let's think of next step. So no, you need to talk to her about, like e- unplanned, for any unplanned pregnancy. He needs to cover herself up.
Yeah.
Either she needs to get something like her, I mean, either copperty or fallopian tube, or I mean, she needs help because I don't think so. This guy would use condom or anything like that and
No,
protect her.
he's not someone he is okay. He's like, I don't want more children. It's okay. I will take care of only these many. It just happened unplanned. But the thing is that she feels that no one cares me, and because of her experience. But I did see the husband to be supportive at the end when she started actually getting contraction. He was there. But again, blame game is always there. No, they want someone to be blamed. I know she would be the first, and the second would be me and Tapasya. So
I think
that
you'll
is
be first. No, I think you come first. Don't worry. Don't worry, Sneha. You're first.
yeah.
No, but I think it's a good thing to continue to think about, to continue to prepare ourselves.
So
It's
just to
certainly for
understand the
me.
situation, I actually studied the bladder part, the urinary system very well after coming to this 2 days back. So I understood that there's a lot of attachment between the uterus and the bladder. They're very near to each other, and so,
And
Yeah,
mutually
bladder is
affect
sitting on
each
the
other.
uterus.
so this
Yes.
Actually,
is
bladder is sitting on the uterus.
this picture. The
Sitting.
black part is the bladder.
I can't see it. Which book is this, Sneha?
This is
Looks like
holistic
Anne
nutrition
Fry.
volume 1. Is this the bladder, the black color part? No.
I think they are showing the lower uterine segment.
Yeah, I can't see it.
Uh,
This T shape.
yeah, no,
Oh, those
bladder
are the
is
different
outside.
incisions. Okay.
The third picture shows the bladder.
So
Third
this is the
one,
bladder.
yeah, the
Okay.
white one, right, KL?
I don't know. I can't
Right,
really
KL?
see these. It looks like incisions, the different incisions that they're using.
So what is
Yes,
this?
but the third one you can see the bladder down,
Yeah.
like there's a vertical incision, and in the lower segment there's a bladder.
Hmm.
Well, it looks
If it is.
either way, it all looks like in the right place. That's
Yeah,
where your
yeah,
bladder would be, roughly there,
yeah.
which is
Which book
why
is
it
this,
gets in the
Neha?
way.
So
It
we had
gets
a
in the
similar
way.
we had a similar case like Tapasya, and I was just overlooking, but there was another doula, and this mother was having contractions, but her urine retention was happening, and the bladder was full. She was not able to pass urine, and her contraction had stopped. And that was a time when they also did a cesarean. She was also trying a VBAC. They did a cesarean, and there was a lot of meconium. Aspiration happened for the baby, while the baby was sounding good on NST as well, CTG or NST in labor. Everything was fine. But after cesarean, the baby took around 15 days in the NICU. So bladder and those babies coming out of it, via cesarean, I could find this thing, which is common. I don't know. Now the baby is healthy, fine. But initially it was tough for the baby. That was a baby boy. So that was bladder, being full and not able. They catheterized thrice in labor, but her labor had already stopped, meaning there was no contractions coming. So that time we understood that the bladder is kind of protecting the uterus, and the baby is not descending. But this time it was all opposite. So I was confident that if she's urinating, then there's no bladder problem.
Yeah.
And when
Well,
she said bladder bursting, I'm like, okay, how can the bladder burst? Okay. So that was,
So I have also learned this. Nothing, like no two situations are the same, right,
ah,
Kale? And things happen
100%.
beyond, and things happen. So let's say we are very firm, we are very certain this is the complication, because we have
ah,
seen one complication like
yeah,
that earlier. But then I started saying to the mothers that, whatever you are thinking will not happen. Something beyond that will happen, because you
Oh,
can't you something beyond your. I mean, it is such a vast universe that they already
yeah.
know what you are thinking, and that doesn't happen. I
You
mean,
know,
something
that's what
beyond
the joke
your
is, right?
imagination.
How do you
I would
make
Yeah.
like
God
to add
laugh?
this. I would like to add there that even in the labyrinth, we say that prepare
Yeah.
yourself
Yeah.
for
Yeah.
something unexpected, right? So we are
Right.
preparing ourselves for something unknown, because nobody is going to tell you that this is going to happen and this is how it should be and
Right.
this is what you can
Right.
expect. No, there's something else that can be happening for sure. So just prepare
Right.
yourself for
Right.
something which is not
100%.
unknown.
O- Okay.
And that goes
So,
for
okay.
everything: labor,
Yes.
delivery,
Yes.
raising kids, and building a house. It's all the
Yes.
same.
Yes. I have a question about one mother that is coming to me. Can I ask now? Is this the right time?
Yep.
So she came to me. This is her second time. First, so she's a second time mother. No, he's history of abortions, but first time C-section. Cesarean happened because the baby was breech at Cloud9, and there is no scar tenderness. 4 years, and this is now she's into her pregnancy. I think it's her 23rd week. She came to me, and she was also going to Cloud9 now, and I asked her to meet Dr. Sushma, and she's planning to give birth there. I might get involved, I might not get involved. It all depends. But she's having very distinct pain at the pubic symphysis and the ischial tuberosity, like exactly these 3 points, especially
Hmm.
when she moves from left to right
Yeah.
and
Yeah.
left to supine, and then supine to right. So very distinct
Yeah.
shooting pain. So I have one was a B12 deficiency, one was a magnesium that I suggested. So I've given her a magnesium spray. I've B12, but KL, we need solutions from you.
So it sounds to me like that separation of the symphysis with the relaxin hormone. So I
Right.
have this too. After my first pregnancy, I can't remember, but certainly in the last three, at least the last three pregnancies, I was on a walking stick. So
Hmm.
because it became so painful. And what it is the relaxin works so well on my ligaments, and including that the symphysis
Bone.
pubis, where it's that
Right.
jelly bit, it goes soft. So as you walk, your pelvis isn't, it does this, and that catches
Hmm.
your sciatica nerve, which is why it's going to hit you in the middle and in each leg, and every time you roll over and walk. So
Hmm.
sadly, there's not much you can do. I would tie something around my hips to try to bind it together to stabilize my hip. That's what I was trying to do. But of
Mm-hmm.
course, as you move, it just gets looser and looser. I did use a walking stick. That was what helped me. And as soon as I gave birth, it went away, like
Okay.
immediately. The next day, I was fine. But right up until birth, and with each subsequent pregnancy, it happened sooner and sooner, meaning I used the walking stick earlier and earlier.
Earlier, like
Yeah.
third month, second month, like that you were
Something
saying.
like this. I probably started at the 8th month, and then the 7th month, and then the 6th month. I'm on a walking stick,
Ah,
like this.
oh.
Yeah, and
And
then
she was asking me that will this pain interfere in her birthing? Like, will this pain
sadly,
excruciate
no.
if she has labor? Okay. And will this pain, so let's say when her labor, so when her contractions will go denser, intense, and painful, will this pain also get denser and painful, or this pain remains the same?
I didn't notice it. I wasn't aware of it. I was aware of
Okay.
everything else, but that pain
Okay.
didn't bother me at that point. That wasn't bothering me
Got
that
it.
I
So,
recall.
because she's a VBAC mother, so she was also concerned that with this pain now, will she be able to go for a trial? So,
So,
okay,
well,
so that's a good sign.
absolutely, there's nothing stopping her from a trial. And the real
Right.
deal is, how strong are you
Mm-hmm.
mentally?
Mm-hmm.
Mentally, how strong are you? Now, pretty much no one dies from pain. Pain doesn't actually kill you. It might make
Mm-hmm.
you want to kill yourself, but you don't usually
Mm-hmm.
die from pain. How
Got
much
it.
pain can you tolerate? Now, especially if you're fearful, pain is more
Mm-hmm.
excruciating. If you are
Correct.
already nervous of the situation, you're tense. So the pain is
Mm-hmm.
just going to be worse. But if you're
Mm-hmm.
still, I mean, I'm the kind of person that is used to tolerating. Can you tolerate? How good are you at tolerating? How strong are you? You can if you want to. The pain's not going to prohibit you. It's not going to stop you from giving birth to a healthy, normal baby. It's not going to stop you from having an absolutely perfect physiological delivery, vaginal delivery. That's not going to
Mm.
stop you. Your fear of it might.
Got it. Got it.
Yeah.
So, yeah, so I will let her know. And
Yeah.
yeah, it
And
is
just
amazing
breathe through it. Yeah.
and just,
Breathe through it. Again, just sorry, but it just seems to me that life is just full of shit. It just keeps coming and getting you. It doesn't look. I love it here. I sit here. My life is easy. I do nothing. I don't have to work, and I can feed myself. But Jesus Christ, the scratches and scars I have. It's just wherever you are, no matter what the situation, there's happiness and there's distress. Can you still maintain a balance?
mm,
Happiness, distress, pain, suffering, and elation. It's all there. We just keep getting tossed around. How
mm-hmm,
long can you hold your breath? Just
mm.
tolerate. You can get through this. And if you have any trouble, call Sneha.
Hi.
Neha
If we
is
have
very
any
used to.
problem, and if you have parents that you don't like and a
I
stupid
am
husband,
I
call
am as
Sneha.
you. Tapasya is a pro, and I'm learning from her.
Neha.
Okay. All right, everybody, I'm going to call it a day. That was really
Yes.
good. So let's try to either, as you like, Tuesday or Thursday. You let me know what day is good for you, and we'll pull another class.
When are
And
you
I would
planning to come,
encourage,
KL?
well, first I have to get my pension. It'll probably be March, April is what I'm thinking. But first I have to get my
Oh,
pension. And until I get the pension, I really won't know what I'm looking at. So
Okay.
yeah, I need that first. And then I'll apply for the visa and let's hope I get it.
Yes, yes. And
I might
your
have to ask
you
you
have
guys for favors. Letter.
and yes, yes. And you have already shifted to the rural setup you were saying.
Yeah,
And
so I've moved
so
house already. Yeah,
okay,
yeah.
okay. So you're yeah, okay. So uh, so that is all done. I mean, you don't have to come back and look for a place. You've already
No,
done that,
no.
and
I
that
already
place
got
is
the
rented
place.
out.
All my stuff is moved. I've already moved into the new place.
Move the
Yeah,
space. Okay.
yeah, yeah. And it's a
And
nice
okay,
space
got
too.
it. Got it.
Yeah. So
It is a
we'll have,
nice place.
yeah,
Do send
yeah, we'll be
pictures.
able to do more fun things with kids. There's there's even a little bike, pedal bike and a scooty in the house so they can go, kids can have fun.
Ah, that's interesting. So you mean there's a angan, there's a there's an open space.
Yeah, there's an open space and they can move around. It's nice. It's nice. It's good. It's good for
Interesting.
conferences. And I've
Okay.
delivered a number of babies in that building too. Actually, about 4 or 5
Mm-hmm.
babies were born there. Yeah. So
Mm,
it's perfect.
okay.
Okay, thank you so
Take your
much.
time, KL.
And
Yes, take your
I'll
time.
see you guys soon, very soon.
Thank you
But
so much. Yeah.
think about
Yeah.
how we will educate the women and what we're gonna, yeah, what are we gonna do with these women? Think about it and let me know what you've decided.
Uh-huh.
Yeah.
My husband's already like, let's have a farm in 7 8 years, and I'm thinking, okay, I want to do my midwifery, and sometimes I think, really, is that a plan? Like that, really?
Yeah, when we have
Obstetrician.
quick births, baby coming, mother is fine. We want to do it long. When we have such kind of birth, no, we're done. We're done. We need to take a break.
Yeah,
So
you deserve some
it's
fast
the way.
labors now. 2025, fast labors.
And I've received a shepherd's purse. So thank you
Yeah,
so
Oh,
much
good.
for getting it couriered. I'm sure it was a task coordinating and we did all that. So a big thank you to her.
Great.
So
Yeah, yeah.
shepherd first only used to get the placenta out, right?
To stop hemorrhage.
To stop the
Stop
hemorrhage.
hemorrhage.
That's the first thing is the hemorrhage. So yes, it might help with the placenta if that's the reason why she's hemorrhaging. Yeah,
Okay.
but it does work magic with stopping a hemorrhage. Doesn't it, Shanali?
So hemorrhage will come after the placenta's birth or before also it might.
Anytime. If you see her bleeding or you're thinking she's gonna, give it to her.
Okay.
So for instance, we could have been giving that mother who hemorrhaged as a result of a retained urine. I did give her shepherd's purse and that stopped it. I could have given it to her before the baby was born when she was pushing because there was an indication that she would hemorrhage because she had the retained a long labor, long second stage, and she had the retention. And I had to catheterize her twice. She was more likely to hemorrhage. So at that point, I could have given her shepherd's purse. I didn't, but I could have. It's just an example. If you think she's up for a hemorrhage, you can give it to her then. So it doesn't matter what the reason is for the hemorrhage, just give her the shepherd's purse and then try to figure out what's going on at the same time. Like that. You'll get it. And you'll be able to make parathas at the same time. I bet you, Sneha.
You'll be able to make what?
Parathas.
Parathas.
No,
She'll get one kid doing, one of her boys will do super pubic pressure. The other one will mix the dough. She'll give the shepherd's purse.
But I do think that having someone with you does matter when you go for births. Not
It
going
does
alone.
help.
Yeah, it
It's
does
always
help.
better. It's always better to have an extra pair. It's always funner to have an extra pair of hands for sure.
Yeah. I wish I attend births with you and Tapasya, but
Well, you'll get your chance.
you guys are just on vacation. No plans.
Well, you'll get your chance this year.
Sure, sure, sure. Take care. Bye bye.
Okay, everybody. Thank you so much. Have a great day. Bye.
Yeah, bye.